Just because you spend less money on something doesn't mean it can't get better. In fact, the private sector does that all the time. The phone you have in front of you is cheaper now than it was before, but it's a better quality than it was before. And that's one of the things we're trying to drive into Medicaid as part of this discussion about replacing Obamacare. We're trying to make Medicaid a lot more efficient.
So there we have Budget Director Mick Mulvaney explaining this morning why the GOP's new health care bill will stop the Medicaid expansion put into place by President Obama's Affordable Care Act. Joining me now, Michigan Congressman Dan Kildee, a Democrat and member of the Financial Services Committee. Sir, it's good to have you with me. How do you respond to Mick Mulvaney there?
Well, you know, I understand in theory what he's saying, but it just doesn't make any sense in practice. By essentially kicking people off Medicaid, it does save money. It doesn't save money for the people who lose their health care. I mean, if they're so interested in saving money, why is it they are making huge tax breaks for insurance CEOs? I mean, maybe if they were paid less, they would be more efficient. It just doesn't make sense. We ought to be clear about this. This is a huge tax break given to the wealthiest Americans, to the richest people, to insurance executives, and it's a loss of coverage. People will pay more for less under Trumpcare. And we shouldn't try to pretend or disguise it as anything else than that. This is a huge transfer of wealth from hardworking people to the people at the very top.
And we hear from Speaker Ryan that people will get it if they want it. Is the bigger concern about that, they can really only get it if they can afford it? They may want it, but they might not be able to afford it this time around.
Well, it'll be far less affordable. The support is a lot less, especially if you're age 50 to 65. Get ready, fasten your seatbelts, because you are going to pay an age tax for having health insurance. You won't be eligible for Medicare. You're not going to get the kind of help that you need from the premium supports. And now, under Trumpcare, a person of that age will have to pay 5 times what a younger, healthier person would pay. Under the Affordable Care Act, that was limited to 3 times. So the costs are going to go way up for people who can least afford it and who need health care the most under Trumpcare. It's a big step in the wrong direction. And there's, I think, good reason that the Republicans are struggling. And there's also good reason that they're trying to rush this through before tomorrow. They're trying to get commitments before the Congressional Budget Office releases what I think will be really bad numbers for this whole plan.
We know that Sean Spicer worked at trying to delegitimize the bipartisan efforts of the CBO before they have an opportunity to look this over and basically grade it. But as you just said right there, an age tax for people 50 to 65. If you can prove that and continue to talk about that for people, whether they're Republican or Democrat, that's a big red flag for people to think about an age tax. With the Democrats in the minority, though, what is your game plan?
Well, I think it's just to expose the real elements of this plan so that people understand. Millions of people will lose their health care coverage. If you get coverage, it'll be lesser coverage. It won't cover what it covers under the Affordable Care Act, but it will cost you more, and there will be a huge transfer of wealth through big tax breaks going to the richest people in this country. When people understand that, and they know that especially those that are age 50 to 65 are really going to have to reach into their pockets and pay a whole lot more, we're going to go back to that time that we don't want to go back to, where health care and health insurance is limited to the privileged few who have access to means, and that everybody else is going to be on their own. Never mind the fact that that Medicaid will likely be reformed in a way that basically makes it inaccessible to all but the very poorest people. And
but you do believe, though, that there need to be updates to the ACA for pitfalls and experiences that have come from actually letting it live and breathe and figuring out where those pitfalls are. So the Governor Kasich was on Meet the Press today saying that the president is open to compromise. Are Democrats willing to put forth any compromise?
Well, if the compromise is to work on those areas of the Affordable Care Act where we know we could make it better, like, for example, allowing the government to negotiate for prescription drug prices so that we're not at the mercy of the pharmaceutical companies, or to allow people to take their dollars and their premium supports and buy in to Medicare so that there is that public option that provides the competition that is so lacking in some areas. I mean, those seem to be the areas where we could affect costs and improve quality. But the Republicans have never really been willing to work to improve the Affordable Care Act because they never wanted it to work. There are things that we could do. But what we have here, what this plan does, essentially takes us back to a different time when if you had enough money, you can get health insurance. If you had a pre-existing condition, you were on your own. This puts really insurance companies back in charge. They talk about how they want to put doctors and patients back in charge. Mm-hmm. Well, they should have done that. What their plan does is increases compensation to wealthy insurance company executives and puts them in much more in charge of health care, dictating terms to the marketplace, saying what we are willing to insure and what we won't. You know, this is. We know the fact that they put this together over just a few days is becoming really evident. They were in such a hurry.
Rand Paul called it a charm offensive taking place right now as they continue to try to make this something that everybody can gather behind. But we'll see what comes out tomorrow, as you said, as this fast tracking continues. Congressman Dan Kildee of Michigan, thank you, sir. Appreciate